Welcome you all to my presentation on prevalence and risk factors of toxocariasis in buffalo calves in coastal, northeastern and northwestern regions of Bangladesh. I am Hiranmoy Biswas, a PhD fellow in the Department of Parasitology at Bangladesh Agricultural University, Mymensingh. It's my immense pleasure to have this opportunity to present a part of my PhD research findings at this prestigious 28th International Conference of the World Association for the Advancement of Veterinary Parasitology 2021, Dublin, Ireland. First of all, a few words on toxocariasis. Generally, toxocariasis is caused by Toxocariasis species, a highly prevalent zoonotic parasitic infection of worldwide that affects dogs, cats, as well as otter buffaloes and cattle. The bovine toxocariasis is caused by the gastrointestinal nematode Toxocara vitulorum, a large roundworm of otter buffaloes, including cattle and other bovids. Distribution of this parasite. It is distributed worldwide but mostly found in tropical and subtropical regions of the world, and also it documented in Italy, France, Greece, Belgium, the Netherlands and the United Kingdom. The bovine toxocariasis is characterized by loss of appetite, diarrhea, anemia, weight loss, stunted growth in younger calves. It has been reported as the topmost cause of morbidity and mortality in buffalo calves. If not controlled, the morbidity can reach up to 100% and mortality 50% in buffalo calves in 1 to 3 months of age. Buffalo is known as the black goat in many Asian countries in terms of its food value and economic contribution. The world has about 200 million buffaloes. 97% of total buffalo population of the world are reared in Asia, and India, China and Pakistan possess most of the buffaloes of Asia. Once it was an Asian animal, the animal is nowadays reared in all the continents due to advantages associated with it. Buffalo farming is therefore spreading in USA, Europe and South America. Well, in this context, now I would like to say a few words on buffaloes in Bangladesh. Buffalo hold strategic place of overall livestock economy of Bangladesh for more safer milk, meat and draught power. However, the buffalo development in Bangladesh has not yet reached the desired level compared to the SAARC countries, especially India, Pakistan and Nepal. Prevalence of parasitic disease is one of the critical constants for buffalo development in Bangladesh. Among the parasites, Toxocara vitulorum is the paramount cause of death among buffalo calves in Bangladesh. The diagnosis and control of the disease is not easy, as the larvae migrate in the tissues, remaining as dormant or hypobiotic parasites. The protective eggshell of Toxocara vitulorum provides resistance against adverse climatic conditions, the egg remaining viable for many years in the grazing land, acting as a permanent source of infection. Dams are the source of infection for newborn. The infected calves act as a major source for the pasture from where the animals are infected through oral route. This disease is also discussed to be a zoonotic importance, such as visceral larval migrants, so it's a silent hazard for both human and animal. The objectives of our study were estimation of prevalence of Toxocara vitulorum infection in buffalo calves from coastal, northeastern and northwestern regions of Bangladesh, identification of the associated risk factors of toxocariasis in buffalo calves. Now, materials and methods. A cross-sectional survey and simple random sampling was employed in selected 4 regions of Bangladesh from July 2018 to December 2019. A total of 1,751 samples were collected from 4 regions. Out of it, Borishal coastal region 515, Chattogram coastal region 407, northwestern region 411 and northeastern region 418 samples. Sample size was calculated through the equation described by Thursfield. The data were processed using computer program SPSS20 for statistical analysis to estimate the strength and statistical significance of the association between predictor variables and Toxocariasis infection. At first, data were organized for univariate analysis to find out the effect of individual risk factors on Toxocariasis infection. The variables that resulted significant in the univariate analysis had been selected for potential candidates for multivariate model. The logistic regression analysis with backward stepwise elimination method. The p-values for data inclusion and exclusion were set at 0.05 and 0.1 respectively. Kruskal-Wallis test was used to compare the mean EPG value of fecal count. Sample size was calculated through the equation described by Thurstfield. The data were processed using computer program SPSS 20 for statistical analysis to estimate the strength and statistical significance of the association between predictor variables and toxocariasis infection. At first, data were organized for univariate analysis to find out the effect of individual risk factors on toxocariasis infection. The variables that resulted significant in the univariate analysis had been selected for potential candidates for multivariate model. The logistic regression analysis with backward stepwise elimination method. The p-values for data inclusion and exclusion were set at 0.05 and 0.1 respectively. Kruskal-Wallis test was used to compare the mean EPG value of fecal count. Now the results of our study. Among the examined sample, 402 were found to be infected with toxocariasis infection. The overall prevalence of toxocariasis infection was 22.96% and the overall mean EPG was 1031.79. The regional distribution of prevalence and intensity of infection ranged from 8.37% to 35.73%, and the EPG was ranged from 235.48 to 1484.80, and the significant variations was found among the regions. And detailed data were shown in the table 1. Among the 4 study regions, highest prevalence of toxocariasis infection in buffalo calves was found in Borishal coastal region 35.73%, followed by Chattogram coastal region 29.24%, northwestern region 15.57%, and lowest infection was found in northeastern region 8.37%. In this slide, we shown seasonal and age-related prevalence of toxocariasis infection. Among the remarkable 3 seasons in Bangladesh, significantly highest prevalence was found 26.68% in rainy season, followed by 21.72% in winter and 20.53% in summer season. Among the different age group of the buffalo calves, highly significant variations was found 49.04% in 1 to 3 months of age group, followed by 24.27% in 3 to 6 months and 6.71% in 6 to 12 months of age group. The prevalence of toxocariasis infection in male and female were more or less similar. Slightly higher prevalence was found in female buffalo calves, that was 23.43%, and in male 22.28%. And in between buffalo types, the indigenous river type buffalo was more prone to toxocariasis infections. We found 35.53% in indigenous river type buffalo calves and 8.37% in swamp type buffalo calves. On the basis of body condition score, higher prevalence 36.3% was found in poor health buffalo calves, followed by 22.23% in medium health and 14.95% in good health buffalo calves. And on the basis of fecal consistency, higher prevalence 36.92% was found in buffalo calves with short feces, followed by 17.42% in buffalo calves with watery feces and 17.71% in hard feces and 10.14% in buffalo calves with normal feces. The results of univariate analysis of risk factors for toxocariasis infection. Among the studied predictor variables, the region, season, age, types, body condition score, and buffalo calves with short faces were selected as potential candidates for final regression model on the basis of p-value through univariate analysis. The results of final multivariate analysis of potential risk factors associated with toxocariasis infection in buffalo calves. Finally, according to the chronology of highest odds ratio and p-value, Boreal and Chattogram coastal regions, buffalo calves with short faces, poor health buffalo and rainy seasons were selected as risk factors for toxocariasis infection in buffalo calves in coastal, northeastern and northwestern regions of Bangladesh. In conclusions, toxocariasis in buffalo calves is endemic in Bangladesh. Young age, coastal region, poor health buffalo calves with soft species, and rainy seasons are identified as the risk factors for this infection. Young calves should receive timely attention as they are the most vulnerable to toxocariasis infection. Further study on the anthelmintic resistance and phylogenetic analysis should be conducted to understand the host-parasite relationship of these parasites in Bangladesh. The authors would like to express their sincere thanks and gratitude to Bangabandhu Science and Technology Fellowship Trust under the Ministry of Science and Technology of Government of Bangladesh for funding support to this study. The Zoetis Grant Fund for the support of the cost of registration fee, Department of Livestock Services officials of respective upazila to assist the selections of buffalo farms during sample collections, and finally the buffalo owners to allow buffalo calves for sampling. This is all about of my presentation. Thank you all for your patient hearing.